Okay, guys, this is chapter 8, pathophysiology. So pathophysiology is the study of physiology of order and functioning in the presence of disease. Okay, so this is when the body can no longer maintain homeostasis, and a disease may result. So you must understand the way disease alters the structure and function in the cells. So atrophy is the decrease in the cell size due to a loss of subcellular components. Hypertrophy is increase in the size of the cells due to synthesis or more subcellular components. Hyperplasia is the increase in the actual number of cells in an organ or tissue. Dysplasia is the alteration of the size, shape, and organization of the cells. And metaplasia is reversible cellular adaptation, in which one adult cell type is replaced by another. So disruption in homeostasis can cause or exacerbate various disease processes. So this exacerbate means it makes it worse, very short amount of time. A lot of time we hear about COP exacerbation when our COPD symptoms gets to the point that we can't control them. So changes in fluid electrolyte balances, they can cause excessive output of urine or excessive input and unable to produce the output of fluids. Degree of fluid imbalances depends on the patient's size, age, and underlying medical conditions. Okay, so end-stage renal failure, CHF, different things like that. So fluid therapy is a fundamental step in resuscitation. How we maintain it depends a lot on our patient's history. If we have a CHF that's got a lot of maintenance, a lot of fluid on them during a resuscitation in an event, we don't want to give them a lot of fluid. On top of that, we used to be bad for just letting the bags of saline just flow. However, now we try to control that, even if it means a saline line with epinephrine being given with 10 cc syringe of saline behind it, and that's it. So we have to think about all these things during our patient care. So edema is swelling caused by excessive fluid trapped in the body tissues. It can increase capillary hydrostatic pressure, such as allergic reactions or inflammation, venous obstruction of pregnancy and heat stress. It could be decreased colloidal osmotic pressure in capillaries, decreased production of plasma proteins in patients with liver disease or severe protein deficiency. So increased loss of plasma proteins from kidney diseases or extensive burns. And it can also be caused by obstruction of our lymphatic vessels. So we must make sure that we auscultate birth sounds, evaluate for repeater and sacral edema or in jugular venous distension, and then also evaluate our vital signs. Isotonic fluid deficient is decreasing extracellular fluid with proportionate losses of sodium and water. So the most common form is fluid loss. So isotonic fluid excess is a proportionate increase of sodium and water in extracellular fluid. And this can be caused probably due to kidney or heart failure. So sodium regulates fluid balance, total fluid volume, and blood pressure in the human body. It also facilitates muscle contraction and nerve impulse transmission. So a hypertonic fluid deficient occurs due to a disproportionate loss of sodium during water loss. So hypernatremia is a serum sodium level of 146 milliequivalents per liter or higher in our blood. So that's more salt than what we need. Hyponatremia is a serum sodium level 134 milliequivalents per liter of blood or less, and that means we don't have enough sodium. All right, so some causes could be excessive sweating and heat or during exercise, gastrointestinal losses through vomiting and diarrhea, and inappropriate use of intravenous fluids or diuretics. This is something that we have to keep in mind during our treatment also. Are we causing our sodium to be shifted one way or the other? All right. Potassium is also crucial in our potassium sodium pump. So Normal serum levels of potassium include 3.5 to 5 milliequivalents per liter. So hypokalemia is a decrease in serum potassium level. Causes could be decreased dietary potassium intake and absorption, or a decreased shift of potassium into the cells through our pump. Okay. Also, renal potassium loss or extra renal potassium loss. Hyperkalemia is elevated serum potassium level. Causes include decrease in excretion, shifts of potassium from within the cell, and excessive dietary potassium intake. So hyperkalemia or hypokalemia can cause a lot of cardiac problems. It can lead to cardiac arrhythmias, and it's something that we have to keep in mind. We usually look at our T waves when we're dealing with both of these, and we'll probably go over that later. All right, calcium. It's nearly about 98% found in our bones. So it lends strength and stability to the collagen and ground substance that form the matrix of the skeletal system. It enters the bone through the body through the GI tract. Normal levels are 8.6 to 10.2 milligrams per deciliter. So hypocalcemia is a decreased serum calcium level. It could be decreased intake, increased calcium loss, endocrine diseases, or sepsis. Hypercalcemia is an increased level of calcium, and it could be increased intake, endocrine disorders, neoplasms, or miscellaneous causes. So this picture just shows the regulation of blood calcium throughout the level, blood calcium level throughout the body. All right, phosphate is essential to many body functions. Decreased level of serum phosphate causes include decreased supply absorption, excessive loss of phosphate due to the use of diuretics, intracellular shift phosphorus, electrolyte imbalance, abnormal loss of nutrients. So hyperphosphatemia, increased level of serum phosphate, massive load of phosphate into the extracellular fluid, or decreased excretion into the urine. Magnesium is 50% stored in the bones, 49% in other cells, and 1% in the extracellular fluid. So same thing, normal levels are 1.2, 1.6 to 2.6. All right, pH is measure of the acidity or alkalinity of a solution. The lower the pH, the higher the acidity. Acidosis is an increase in extracellular hydrogen ions, and alkalosis is a decrease in extracellular hydrogen ions. So decreases in or disturbances in acid-base balance are associated with the disturbances of potassium balance. So there's a direct correlation in here. Okay. So respiratory acidosis is related to hypoventilation. All right. And then respiratory alkalosis is associated with hyperventilation. Okay, but so, and if you think of a tank being filled during hypoventilation, okay, so like our lungs are not expanding, they're not moving anything during hypoventilation, then we keep in the hydrogen ions, so we'll keep it in and becoming acidic. Okay, during hyperventilation, we get rid of that acid, we're possibly decreasing that tank, so that's where we get respiratory alkalosis. Okay, metabolic acidosis and alkalosis is going to be hard to determine without the proper blood work. So but we can think of it sometimes. It can be lactic acidosis, ketoacidosis, aspirin overdoses, excessive alcohol ingestion. So metabolic alkalosis could be sometimes it's rare and acute condition, but excessive vomiting, excessive water intake, gastric suctioning, and things like that. All right, cellular injury could be due to hypoxia, ischemia, chemical injuries, infections injury, um, immuno injuries, physical damage, and inflammatory. Okay, so we have the loss of nuclear staining here on the left, and then nuclear debris here, because the picture on the left here is normal, the picture on the right is not. Okay, so we can see that breakdown of nuclear material has the chromosomes. So the injuries may be resulting from oxygen, a decrease in oxygen in the air, a loss of hemoglobin, decreased number of red blood cells, disease of the respiratory cardiovascular system, um, loss of cytochromes. So if they are hypoxic for more than a few seconds, it produces mediators, which lead to more cell damage. So these free radicals are the earliest and most dangerous mediators produced by the cells. Chemical injuries could be cyanide, which induces hypoxia, pesticides, which prevent proper transmission of nerve impulses, long-term ingestion of lead that leads to brain injury, neurologic dysfunction, carbon monoxide, which prevents adequate oxygenation of the tissues and cells, and high doses of ethanol, which produces severe CNS depression and hyperventilation. Infectious injuries occurs as a result of invasion of bacteria, fungi, and viruses. Virulence measures disease causing ability of a microorganism. A depressed immune system is less capable of fighting off microorganisms, and then viruses take over the metabolic process of the host cell and use the cell to replicate. Okay, so it can replicate at the core of the RNA and the DNA. So many bacteria have a capsule that protects them from ingestion and destruction by phagocytes. So this process of bacteria, or the presence of the bacteria in the blood, is called bacteremia. Okay. So you've got the cell wall here, the cellular DNA in the middle, and that capsule around, and that cytoplasm helps protect them from phagocytes invading into the DNA. Our inflammation is protective response in the presence of cellular injury. So many signs of heat, redness, tenderness, swelling, and pain. So if it is a process of severe systemic effects may become evident. So, when people feel ill and their temperature is elevated, the bone marrow accelerates its production of leukocytes, and that's your white blood cells. Okay. This figure shows the local systemic effects of tissue injury caused by various agents. All right, an abnormal gene may develop if by mutation of the gene during meiosis, by heredity, or as a result of other causes later in life. So genetic factors that may damage cells include chromosomal disorders, premature development of atherosclerosis, and sometimes obesity. So nutritional stuff, malnutrition, vitamin excess or deficiency, and mineral excess or deficiency. Heat or cold or radiation could be cause injuries to the cells. So degree of cell injury is determined by the strength of agent and length of exposure. All right, apoptosis is normal cell death. It's genetically programmed into the cells as part of the normal development. Organogenesis and immune function and tissue growth. So proteins in DNA undergo controlled degradation that allows their remnants to be taken up and reused by neighboring cells. They can be activated prematurely by pathologic factors such as a cell injury, and inhibition of the normal course of apoptosis allows destructive cellular proliferation. Okay, so here's some different factors. You have the normal cell, then it becomes an abnormal cell and affects the immune system itself, and it can either cause cancer by meiosis or growth of it, or it becomes the destruction of the abnormal cell. So necrosis is tissue death, and that is a result of morphologic changes that occur following cell death. All right, hyperperfusion. Perfusion is the delivery of oxygen, nutrients, and removal of the waste by the circulatory system. Okay, so we want our circulatory system, we want our vessel system with our heart always working. Okay, and that includes the lungs, the GI system, everything put together. We want to intake in O2, putting it out to the cells, and then the cells releasing the CO2 and the waste out through which we know whichever method it needs to go out. So hyperperfusion occurs when the level of tissue perfusion decreases below normal. So when blood pressures drop, heart rates drop, the body's response is catecholamines, which is epinephrine and norepinephrine. This produces increased strength of cardiac contraction. Your heart starts pumping harder, increased pulse rate because it's trying to make homeostasis normal again. And then it vasoconstricts out from the areas much distal away from the heart, and it increases the systemic vascular resistance. So the definition of shock is that abnormal state associated with inadequate tissue and nutrient delivery to the metabolic apparatus of the cell. Okay, and this can pretty much result in the cell destruction if it is not being adequately perfused. All right, there's many different types of shock. So your central shock is your cardiogenic, which occurs with the heart when it cannot deliver enough blood to maintain adequate peripheral oxygen. Okay, a lot of times it's just your MI stuff. And obstruction shock occurs when blood flow becomes blocked in the heart or great vessels. It's cardiac tamponade. On the left, the peripheral sac, and then the pericardiac sac opens, showing clotted blood surrounded the heart, which compressed the heart, preventing filling of the right ventricle and diastole. All right, shows the sinothoracic aortic dissection. That picture on the left shows a tear in the ascending aorta, causes proximal and distal dissection. And B shows a tear in the descending aorta, which can cause extensive distal dissection. Peripheral shock is hypervolemic shock, where circulating blood volume is insufficient to deliver oxygen and nutrients to the body. There's two types, exogenous and endogenous. Exo just means outside of the cells, and endo or outside the body. Endo means within. And then distributive shocks are widespread dilation of the resistant vessels of excuse me, or both. All right, anaphylactic shock is histamine and other excuse me, or other vasodilator proteins are released on exposure to an allergen. And we'll talk about how to treat those at the AEMT level. Septic shock is a result of widespread infection throughout the body. We'll talk about how to treat that. Neurogenic shock results from spinal cord injury itself, and we'll talk about that, what happens there. So spinal cord damage, the dilated vessels can cause systemic injury to the part of the nervous system that controls the size and muscle tone of the blood vessels. So basically, they just dilate. When they dilate widely, increases the size capacity of the vascular system, and the blood in the body can no longer fill the enlarged vessels, which results in inadequate perfusion and neurogenic shock itself. So we want to reduce the cardiac output, the circulatory insufficiency, and then the rapid heart rate itself. Okay, so you need to evaluate the presence of volume of the peripheral pulses and assess in-organ perfusion and function. So if a patient is starting to model, you see pallor, you see peripheral central cyanosis, or a delay can't refill, this pretty much are signs that the presence of shock is already there. Okay, decreasing levels of end-tidal CO2 are also an early indicator of shock. All right, multiple organ dysfunction is a progressive condition that occurs in some critical care patients. So it's concurrent to two or more organs or organ systems initially unharmed. So basically, we have two or more systems that fall due to the shock, whichever kind it is, and then secondary ones is a slower, more progressive organ dysfunction. All right, so the immune system includes all the structure and processes associated with the body's defense against foreign substances. So anatomical barriers decrease the chances of the foreign substance invading the body. So pretty much your skin system does this. The hairs in the upper and lower GI tract, respiratory tracts, and acid in the stomach help try to regulate and defend the body from all of these antigens that may be coming in. So then we have two responses. Natural immunity is something that we picked up already, that our body already knows about. And then you have acquired immunity, is where you have exposed your body before, maybe with a shot or a antibody, a vaccine of some sort. So your body knows about it also already, and it remembers it. Okay, this is how antibodies work, and there are many different ways that they come in. Antibodies make antigens more visible to the immune system in three ways. Antibodies act as ospinons. So an antibody coats an antigen to facilitate its recognition by the immune system. The antigen that causes it to clump, and then they bind and inactivate some of the toxins produced by the bacteria. So all your subgroups come in to help all your T cells to help kill the antigen that's coming in. Okay, and that's basically what this shows here, this graph. Okay, this shows the interaction of cell-mediated humoral immunity. And then this shows the general structure of an antibody and what it does. So inflammatory response is the first response. So injury, illness, and infection is your first response. It inflames up. Okay. And then your polymorphic neutrophils arrive, and they go into the intravascular space and extravascular space. Then your cellular event sequence, margination, activation, adhesion, transmigration, and chemotaxis develop, and then all your extra cellular production is inflammation, and all these leukophils, macrophages activate, and they migration inhibitory factor keeps white blood cells at the site. Okay. All right, so we have repair of the damaged tissue, removal of inflammatory debris, and then restoration of the tissues to a normal state, and then regeneration of the cells itself. Okay, and this is how your body heals itself. Many different diseases can cause dysfunction in this. Some being, diabetes, corticosteroids, different things like that. And here's a algorithm to the body's response of looks like a capillary laceration here. Okay, there's hypersensitivity body's response of the body to any substance which the patient has increased sensitivity. So the body does act a different way. And then the allergic reaction response. Immune system targets different molecules depending on hypersensitivity of the reaction. So you have the autoimmune reaction that targets is a person's own tissues, and then the immunodeficiency, the body's immune system is inadequate and resist to infection disease is decreased. Some genetic factors, environmental factors, age-related factors, sex-associated factors can all cause different diseases. Uncontrollable risk of genetics and race, control, smoking, drinking alcohol, inadequate nutrition, lack of physical activity, stress. These are all things that you can prevent with cellular death or causing disease. Okay, if you're gonna smoke, of course, you're probably gonna end up with emphysema, COPD. If you're gonna be a heavy drinker, you're probably gonna end up with liver disease, inadequate nutrition, malnutrition, so lack of physical activity. Of course, it's gonna be obesity. All right, so analysis of the disease risk involves consideration of the disease rates and disease risk factors. Okay, so all studies of disease should be considered the incidence, prevalence, and mortality of the disease. So some risk factors could be age and sex differences. All right, a true genetic risk is passed through generations by inheritance of the gene. So diseases with a family tendency seem to cluster in the family groups despite lack of evidence for inheritable gene-associated abnormalities. So immunologic diseases are caused by hyperactivity or hypoactivity of the immune system. Okay. So this is just a chart with family diseases and associated risk factors. Cancer is described pathology associated with metabolic growth. Diabetes is one of the most significant endocrine diseases. So you may have type 1 ketoacidosis prone or type 2 non-ketoacidosis prone. Here's some hematologic disorders with hemolytic anemia, hemophilia, and hemochromatosis. Some cardiovascular disorders we talk about, and where the problems lie within the heart itself. And then some renal disorders such as gout, kidney stones. We'll talk about that later too. Some GI problems, neuromuscular disorders, and psychiatric disorders. All right, stress can cause physiological response, especially to a wide range of strong external stimuli, physiologic and psychological, and that can cause a physiological response. So, we need to be able to adapt to these situations. So our alarm system usually is first. So it releases the catecholamines. Then we try a resistance and adaptation to the stressors. And this is releasing the pituitary glands of ACTH, or adrenochronotropic hormone. And then the endorphins are released itself. Okay. Then sometimes, a lot of times, we'll just experience exhaustion of it. So the adrenal glands become depleted, resulting in decreasing the blood glucose levels. So decreased stress tolerance, progressive mental and physical exhaustion, illness, and collapse. So this is something that we have to be very mindful of. We get put into a lot of stressful situations on and off throughout our career, and how our body responds to it is, whether we stay in this a long time or we have a short career. Okay. Here's some effects of chronic stress. Okay. All right, that's the end of this chapter.